Hi, my name is Gustavo Santiago, and welcome to my career project presentation as a part of the first year experience SLS 1501 class. So, why I chose nursing? Well, I consider myself to have a pretty long history with the nursing field in general. Back in high school, it offered a nursing program for our LPN, licensed practical nursing. And for the last 2 years of my high school experience, most of my classes revolved around this program. And I am eternally grateful for it because it brought me a lot of clinical experience that was very eye opening to me. And my incredible teacher, Bruce Peters, he is right here, centerfold in the picture at our graduation. He was probably one of the best teachers I've ever had, probably ever will have, because his guidance and advice was always available to us, and even like out of school. I have his number, and whenever I needed anything or had any questions about anything in general, not even related to classes, he would always help me out. He was almost like a father figure to me. He was interactive and truly cared for all of his students. Even students he had nearly 15 years ago are still in touch with him and still update them on their day to day lives and experiences in the nursing field. And I hope I could be one of those students one day. What I expect from this career? Well, nursing as a career is a very fast paced and very unpredictable field because you never know what's gonna happen when you walk into your clinical setting for the day. It has a fast paced working environment because since there's a deficit of nurses, you're gonna have a lot of patients on your hand, and you never know what's gonna happen with those patients. You never know if maybe then one of them might fall, one of them might have an accident, one of them might go to cardiac arrest. You're never gonna know, and that's why you always need to be ready. Some of these situations can be very high stress because you need to be able to know how to save a person's life in an instant, almost like a paramedic. Except when a paramedic gets to a person, they're bringing the person to you. So you're kind of at the back end of that 911 call, and it can be very stressful. And one of the things that's kind of going to be expected of you as a nurse is that you're going to have to be comfortable with loss. You're not going to be able to save everyone. I've seen it firsthand. I felt it firsthand. Having a life slip away, and it's no one's fault really when a life is slipped away, unless of course misdiagnosis or administration of the wrong medication. But when you're doing everything you can and a man slips away from your hands, you got to be comfortable knowing that you've done everything you can and that you cannot sit around in despair when you have 10 other patients to attend to. But over and all, it can be a very emotionally satisfying experience because just knowing that for every soul you do lose, there are nine more who leave your care healthy and happy, ready to live the rest of their lives again. Now, what the nursing career as a whole has actually experienced a lot of growth. As I mentioned before, the nursing field has experienced a pretty big deficit of competent registered nurses. Um, this is mostly because there are current generations that comprise most of the nursing field, and most of these people are actually reaching retirement age. So sooner we might see a lot of retiring nurses, and even bigger gap in what deficit there already is. However, there is already a 15% predicted increase in jobs by 2026, which is considerable as it is one of the highest growth rates of any field out there. And even more so, even after the retiring nurse cohorts, we're going to have the boomer generation, which is arguably one of the largest cohorts of generation or demographics there is right now. They are hitting a critical age, but they're going to need a lot more care. And I've seen it right now. Back in my clinical settings, there was a lot of people from the age of 60 to 80 in those offices. It outranked by far more middle age and younger people. So with all this new influx of people walking in, our nursing homes, hospitals might be overflowing with these people who need care and maybe not have enough nurses to go around. So it's very important that we get as many nurses as we can into the field. Now, as for technology, well, there is a lot of new technology on the rise. Nanotechnology as one, and artificial technology or artificial intelligence. Artificial intelligence is being researched to be used, to diagnose. Maybe for like psychiatric wards, that artificial intelligence may be used, to diagnose, certain psychological disorders because, sometimes it can be hard to diagnose a mental patient. but artificial technology can help, analyze the patient and help make a quicker and easier diagnosis. So us nurses can come in and help those people. And biotechnology for one. Biotechnology is quickly advancing as we have, new genetic engineering, and we're turning to nature itself to derive new technologies for us to use for ourselves. Like, for example, I think nowadays they're using tilapia skin, to treat burns. I think no one would have ever thought of using, fish skin, to treat a burn. But that's the great thing about the medical field. You never know what's going to save you and what's going to not. So with biotechnology and artificial technology, we're going to rapidly grow quick, and hopefully our quality of care will grow right alongside that. Now, nursing has a major here at FIU. Here at FIU in the nursing program, I hope to get, excellent clinical hours, not just in quantity, but in quality. Here in Miami, I would assume there would be plenty of hospitals and plenty of people to go into them, seeing as it's a big city. So you never really know what you're going to see. At a small town where I came from, some things started to become predictable. Like if you were at a nursing home for a clinical setting, of course you would expect a lot of patients with dementia. And after a while, dementia patients can be a little predictable. But at the same time, you never really know if they're going to try to make a run for it. Um, but getting your BSN is becoming increasingly difficult to get because hospitals and the nursing board in general are requiring more and more out of our nurses. Even though there is a deficit, they recognize that it's very important to have quality nurses over quantity. Now, what I've discovered about RN nursing, well, I know personally I consider myself to already be fairly experienced with nursing, so I don't think there's really much, I can discover more about, what I've already experienced. But one of the things I have noticed from my transition from high school nursing to college level is that it is increasingly competitive. One of probably the scariest aspects of college here is not of the classes and not of anything else, but mostly just the nursing program. Probably one of the most stressful things for me at the moment is what I would do if I don't get accepted into this program. It has become so competitive here. It was only 100 students submitted into the program right now. It can be kind of, stressful to realize maybe you just might not make the cut, even though you do everything you can. But, FIU, they have a lot of things to offer to help, make my chances the best they can be. They offer Handshake, which is a job internship, finder. And was that, hopefully I could find maybe an internship at a hospital or even a job, with my LPN license. Having those would be great for me, help boost my career, get the foot in the door, and hopefully boost my chances to get into the nursing program here. And they have various pre-health organizations, do some volunteer work, which is very important when it comes to considering the nursing program, and very fraternities, and organizations, that just help, pre-health students, not just like pre-nursing in general, but like anything that has to do with, the health field, they're there to help. Because when it comes to, the health of like, our fellow humans, everyone is part of a team. It can be nurses, doctors, physicians assistants. Everyone is there to help each other. And one of the most attracting factors, to FIU's nursing program is that it was voted in one of the top 10 nursing programs according to Nurse.org. I've always strived for a quality education, so this is why I'm here at FIU, and this is what I hope to achieve at FIU nursing program, and much more to come. Thank you for watching my presentation.